So good morning, good afternoon, good evening. Welcome to today's Statistics Cafe, back to doing our usual Monday session. And today we're looking at how we can make civil registration more user-friendly. So I'm Rachel Bevan, Director of Statistics Division here at ESCAP. We all know that a well-functioning CRVS system is really important to ensure that every person has a legal identity. This makes so much difference. It means that individuals, children can go to school, they can get access to the hospital when they're ill, and as they get older, they can do things like voting and access other government services. So this is something that actually really makes a difference to people's lives. But despite this being so important, we know that in many countries in Asia and the Pacific, people still face barriers to register these events. The registration process itself can be very complicated, particularly when individuals might not be able to read or write very well. They may need to go to a registration centre multiple times. That may be a long distance for them to travel, and they may actually have to provide various documents that they don't easily have. So all of these factors mean that many births and deaths just go unregistered. Although birth registration's been increasing in Asia and the Pacific, we know that still 1 in 5 children under the age of 5 remain unregistered. So as I'm talking, I want to do some quick audience participation. In the comments box, as I'm talking, if you think that your birth wasn't actually registered on time, just type it into the comments box, into the chat function, and put the country that you're from. It would just be interesting to see whether or not this has actually affected anybody themselves. We also know that it's not just about birth registration. It's actually even worse for death registration. Only a handful of countries in the region have actually got complete death registration systems in place. But we know that that need for high quality and timely statistics on deaths has been really highlighted by COVID. So we need to address these issues. The business process improvement methodology, the approach, is being used now to help us to actually work at the country level to identify those specific bottlenecks that countries are experiencing. And the CRVS Systems Improvement Framework, which has been developed under the Bloomberg Philanthropies Data for Health initiative in collaboration with other partners, is the tool that we're going to be using to apply this business process improvement project. So Vital Strategies, ESCAP, and the WHO Regional Office have been supporting countries in the region to implement the first phase of this framework, which looks at assessing, analysing, and then redesigning the underlying processes around civil registration. And then the objective of today's Stats Café is to actually share experience about how this has been going. So we're going to hear about how this improvement framework is being used in countries, and specifically we're going to hear from 2 speakers about their experience of implementing this project. So that's speakers from Bhutan and the Maldives. So with that, I want to hand over to our moderator today, who is Chloe, who I will leave to introduce herself. So thanks very much, Chloe. Over to you.
Thank you very much, Rachel, for providing your welcoming remarks, and good morning, good afternoon, and good evening to everyone attending this week's Stats Café. My name is Chloe Harvey, and I work with the Civil Registration and Vital Statistics team at ESCAP. It's a pleasure to be the moderator for today's session, and I'm very excited about the fantastic lineup of speakers we have today. So before starting, I'd just like to run over a few housekeeping reminders. We are using a new modality for the Stats Café where everyone's mics and cameras are automatically turned off to reduce the background noise. This meeting will also be recorded, and the video will be made available on the Stats Café website by the end of today. And please do feel free to post all of your questions and comments into the chat box, and we will come back to them towards the end of the session during the Q&A section. The slides have also been added to the Stats Café website, so just in case the connection is bad, you can also access the PowerPoint slides from there. So now I'd like to introduce our great speakers for today. Our first speaker will be Ms. Subhashri Dash, who is a CRVS Systems Improvement Consultant for Vital Strategies. Subhashri has been providing technical assistance to selected countries in Asia for the implementation of the CRVS Systems Improvement Framework. Then we have Mr. Sonam D, who is the Senior Planning Officer within the Policy and Planning Division in the Ministry of Health of Bhutan. And last but by no means least, it is a great pleasure to have Ms. Fatima Riaza, who is currently working as a statistician at the National Bureau of Statistics in the Maldives. She is head of the Population and Social Statistics Division and has been leading the work on conducting the population and housing census. Ms. Riaza is the CRVS National Focal Point for the Maldives and Steering Committee member for the Washington Group on Disability Statistics. We're very lucky to have such an excellent lineup of speakers today, and we really look forward to hearing from you all. But without further ado, I'd like to hand over to Ms. Subhashri, who will be providing an overview of the CRVS Systems Improvement Framework. Thank you, and over to you, Subhashri.
Thank you, Chloe, for the introduction. I'll share my slides. Okay. Thank you, Chloe. So you may all know the CRVS Systems Improvement Framework that was published in 2021 was developed by Vital Strategies under the Bloomberg Philanthropies Data for Health initiative in collaboration with other development partners, namely ESCAP, ECA Center of Excellence for CRVS and the Pacific Community, right? And the framework provides, guidance for a systemic and structured approach for continually improving a CRVS system in any country. So my first slide is about the CRVS Systems Improvement Framework approaches. It adopts a process-centric approach, and this is at the core of the framework. Now, the framework is anchored on a result-based approach right from the beginning and is also rights-based, as I will explain later. The other guiding principles are country-owned and country-driven process, multi-sectoral and participatory approach. The framework is inherently flexible and can be, applied to, in a modular way. For example, the focus can only be on improvement of death registration. So these are the link for the, you can download the CRVS framework, and also you can log in and do the CRVS e-learning course developed by Vital Strategies with other partners. The CRVS Systems Improvement Framework, as you can see from the diagram, is an iterative process. The stage 1 of the framework, the CRVS system is assessed, analyzed, and redesigned. Then in stage 2, based on the recommendations, emerging from the stage 1, strategic action plan is developed. In stage 3, the implementation is undertaken, and the implementation is monitored and evaluated using a monitoring and evaluation plan that will be developed for the, for the purpose. And after the end of the plan period, which is usually between 5 to 10 years and can vary from one country to another, the system is assessed again for the progress made using the framework, and the process becomes iterative. So these slides provide some details of the stage 1 of the framework, which is assessment, analysis, and redesign. I do not want to go in details for each step shown in the diagram. As you can see that the step 1 is assessment of CRVS business processes. The stage 2 is the analysis of CRVS business processes, and the step 3 is the redesign ideas are being developed in step 3, and this forms the basis for the recommendations. Now this the framework uses two main implementation tools. One is the business process mapping, and other one is the CRVS systems analysis and redesign tool, which is the CRVS STAR tool. So business process mapping is a visualization of a business processes and also takes into account roles and responsibilities of each actors in the process. The business process map is therefore the main tool for applying the process-centric approach. Now the CRVS STAR tool is a, this is a structured tool, is used in a step-by-step manner from the beginning. It starts with identifying certain key performance indicators, which are categorized as high level, client-centric and service provider-centric. Then the whole process of the assessment, analysis and redesign are anchored on the identified KPIs, right? And in order to see where you stand today against each indicators, against each indicator, you set baseline, then you set targets for each of them. Then assess the system in combination with RG's business process maps for existing CRVS processes. Then, this helps in identifying the root causes of performance gaps for each of these indicators. Based on the analysis, you develop redesign ideas, which also includes as desired business process maps. Then the use of KPI from the beginning makes the tool result oriented, and the choice of client centric KPI makes it right based, right? So this is the BPM is a process centric approach, and the CRVS systems R tool is a result driven and rights based approach. Now this is an example, this is an example of a business process map, and where you draw the whole process of a system, capture roles, responsibilities of the stakeholders. And this is CRVS R tool, and this is, as you can see, there has 3 sections: assessment section, analysis and redesign section. Now, this slide describes how the framework is usually rolled out in a country. This is more a generic process, but can vary from one country to another based on local situation. So the first crucial step, in the implementation process starts with the establishment of a core team with relevant, government stakeholders, usually led by a civil registered office. But in some countries, this team is led by the health ministry. Now, it is important to also identify a focal point in the government who would coordinate and communicate on behalf of the team. Then a senior advisor, if needed, international expert, and local consultant or consultants have to be deployed for guiding the processes and providing regular advice. The next step is to orient the core team members on the entire process of the framework, and also develop a clear roadmap for the implementation of the framework, right? And in some countries, actually, they have constituted a smaller working team under the core team to undertake the activities in stage 1. They're actually doing the whole technical work. For example, identification of the KPIs, then development of the business process maps, etc. Then the working team usually briefs the core team on the progresses made and then takes guidance on the technical matters. Okay, and in almost all countries, the core team or the working team members were trained on the business process mapping tool and CRVS R tool. Then the senior advisor provides technical advice and inputs to the country, the country level team from time to time or regularly in the implementation of the assessment, analysis and redesign work. Several iterations happen until the final output is ready. And the finding of the assessment are documented, and the recommendations made from the improvement based on the redesign ideas are presented to the core team and high level committee for approval. Now, what outcomes, can we expect after the implementation of the framework? So the process helps all the CRVS system stakeholders in gaining an in-depth understanding of the end-to-end process, as they are fully involved in the whole process. Then the country teams actually gain, detailed understanding of the actions required to be, taken to address the root causes of performance issues in the CRVS system. Then the approach helps in designing a more efficient process that is expected to improve coverage, efficiency, and quality in services. For example, a more proactive system, then optimal use of information and communication technology, then timely delivery of services, right? And it helps in building and improve vital statistics systems, including cause of death, or build one where it doesn't exist, right? And finally, the process helps to establish coordination mechanism and management mechanism, including monitoring and evaluation. Right? And as we stated earlier, the framework is flexible and can be adjusted according to the country need. So not all countries will at the same starting point at the time of the implementation of the stage 1 process, right? For example, a comprehensive assessment may have been recently completed, a strategic action plan may already exist and is being implemented, right? A law may have been recently reviewed or amended. The ICT infrastructure may be at a different levels of maturity. Then the human resource capacity may vary from one country to another, right? Maybe there is no vital statistics systems exist, or vital statistics system is not routinely compiled for civil registration data. So you can see, that the best part of the framework, this of the application of the framework is that it can be adjusted according to the different starting points, right? And the experience so far shows that the proposed approach of the framework, the improvement framework, has been widely actually appreciated and is being implemented in several countries. And there are of course challenges being faced in implementation of the framework as well, which again vary from one country to another. Vital strategies in the process of documenting all the lessons learned and based on the inputs received. So they're planning to make improvements in the guiding document in consultation with several stakeholders. So with this, I am done with my presentation. Thank you so much.
Thank you very much, Shubhashri, for that comprehensive and very clear overview of the CRVS Systems Improvement Framework. It's really useful to have that background before we hear about some of the country experiences of implementing the framework, as I know the process has many different elements to it. I think my colleague Nasir Khan has also posted a link to the CRVS Systems Improvement Framework in the chat box, and also a link to a YouTube video which provides an introduction to the framework. If you have any questions for Shubhashri that you would like to ask, please do post in the chat and we will get to them during the Q&A session at the end. I think our next speaker hasn't yet been able to log into the meeting, so I'm going to move on to our next speaker, and hopefully he will be able to join us a bit later. So now I would like to invite our next speaker, Ms. Fatima Riaza, to take the floor. Riaza will be sharing the experiences of the Maldives in implementing the CRVS Business Process Improvement Project, and how the results of this project have been informing the ongoing digitization of the civil registration system. So over to you, Riaza, to tell us a bit more. Thank you.
I hope you can see my screen in slide mode.
Yes, we can. Thanks.
Okay. So thank you for inviting us to be part of this session, and for the insight we just now heard from Shubhashri with regard to how the CRVS business process is the framework has been developed, and what processes that countries go through in having a CRVS digitalized framework in the country. So if you look at Maldives, when it comes to civil registration system here, we did have a system for the past 10 to 15 years where births that occur in the health facilities was registered directly into the system or at a central level, which is in Male. So if when it comes to birth, the hospital register issues a birth form, which is what we call the Fuluma form, and the birth has to be registered with the relevant authorities in the country within 7 days. And failure to do that, there are certain applicable fees that you need to pay. For the death, there is no legally defined limit as to when you need to register the death, but upon a death, a death certificate is issued, and you need to submit this certificate in order for us to proceed with the burial processes, and which is free of charge here. So if you look at the birth and death registration in the country, the birth registration is almost 100%, and the same goes for the death registration, the issuance of death certificate by the health facilities. And as of 2020, almost all the deaths that occur in the country are in the system. With in July 2020, in June 2020, we moved on to a new birth and death registration system, which is what we call the GEMEN module, a new online birth and death registration platform that we have been able to roll out, and which is right now being used across the country by all the health facilities as well as by all the island and city council. So what the GEMEN does it when a birth occurs, the birth form is being issued through the system and given to the parents. The parents, once a birth occurs, and the parents identifies from which location they are. It is being viewed at each island council level, and through the system their birth registration is done and birth certificate is done once the parent comes to each of these authority with the birth form. So we started rolling out this new system during the COVID pandemic, and we faced certain delays in rolling it out across the country. But we have been fortunate enough to cover the whole country, which is 28 atolls and 188 islands. But what we see today is the system still needs further improvement when we first started with this project. So we were very opportune enough and got I think at the right time that UN ESCAP approached us to try out this business process and see how to apply the CRVS System Improvement Framework for analysis, redesign, and improving the new GEMEN system that we have rolled out. So it's just as we were just now briefed on the processes that takes place. When it comes to modules, we only focused on the stage 1 of the framework, which with 2 key objectives, which is identifying issues affecting the performance of the business process in the CRVS system, and then the root cause of looking at the root causes of these issues. And we also identified the redesigns that needs to be implemented to address the current performance issues in the system, as well as the legal issues that is hindering the implementation of the different activities or the registration of different processes. So following the initial consultation on the framework and discussion on the CRVS process, that is together with the lead consultant, the senior advisor, and we were able to have a national consultant Harper through the process. But at the initial process, we decided that Modis is strictly going to focus on improving the birth and death registration processes. So in line with the framework, we had a co-country team who is actually part of the technical committee for the CRC. I mean, they are part of the CRVS technical committee in the country, and the country team was quite actively involved during the whole project, and we were able to implement the whole framework through following these stages. That is, first identifying the documenting the current birth and death registration process, how it is taking place within the current GEMEN system and how it was taking place in the previous system, what changes came about it. And we also looked at the performance information on the current birth and death registration business process and the performance issues that we are having, and what was the actual root causes for these issues. And then we defined the policies for improving the birth and death business processes, which actually through which the redesigning process of births and deaths takes place. So when we are to talk about the redesigning ideas, the processes that was suggested was the GEMEN system was unfortunately operating right at that time with the pulling only fetching the national ID card number of each person of the parents, but linking these records with the GEMEN system would enable actually the timely verification of the records. The same goes for linking the GEMEN system with the house registers which we have in the country, and completing the collection of key parental information and automating this verification process throughout the system, so that when the parents come for the birth registration and for the issuance of the birth certificate, they do not have to again submit all the paperwork and go through the whole process, whereas it is being viewed through the system. And one of the issues that we faced right now was having different spelling in our local languages when it comes to Arabic names, which is mostly common here. And so the standardizing the way spelling of the names is one of the key ideas that was suggested for the redesign, and which is right now being implemented. Action is being taken for that right now. And linking Gammon with the national identification system to automate and issue a unit ID number for the newborn, and fully integrating this Gammon system with the immigration records. When we look at the death registration, definitely through the process, we identified the death form needs some sort of restructuring to enable that easy and timely burial at the cemetery, so that they can do the entry of the burial data into the system independent of the death certificate. Uh, uh, we still need to create a death registry in the Gammon system, irrespective of the death certificate that is being issued by the health facilities. And of course, we still need to work on the cause of death and trying to best identify the best possible way, and from where exactly we are going to start the coding of the cause of death. The project was implemented for about 3 months, and we have completed the project, and following the assessment and the business review of this business framework and how it can support the ongoing works of the current BRS, the birth and death registration system, based on the redesign efforts and discussions we had with different stakeholders, we have been able to kind of move forward and take necessary actions in order to improve the system efficiency. And one of the key things, and I think it was highlighted in the previous presentation as well, and that was having a fully well coordinated mechanism within the relevant stakeholders, and that's where the reactivation of the CRVS technical team has been done, and we are having regular meetings every 2 weeks where each agency highlights the key issues that they have faced while implementing the Gammon module, and looking how best we can generate the results and address the pending issues. And based on the project, we have made various changes to the Gammon during the rollout, as well as during the stakeholder discussions, during the redesign processes. So, and changes are still being made to the Gammon system as we speak. Also, that is, when an agency identifies a certain issues, it is being right now addressed. But the time taken to address these issues and make modification in the system, there is still delay in doing that. And we have been able to move forward, and we have been able to develop a very brief reporting module, which actually shows us how the function, how it is being used by different island council, the functionality of this system, whether it is being used, which health facilities are using the system, which island councils are not using the system, and we are trying to address these issues by directly contacting these island councils and again retraining them. So in terms of policy changes and the policy key actions that we have taken is one of the key action is moving towards the Civil Registrations Act with the political level blessing, I would say. So right now, together with the Bloomberg funding, we are reviewing the civil registration regulation guidelines in the country to actually have a civil registration in the Civil Registration Act, which actually would provide a strong legal basis for the whole registration process when it comes to birth, deaths, registration in each house registration, update in house registration, issuing birth certificate, as well as for national identification. And Ministry of Health is right now enforcing all health facilities to actually keep using Gemen modules, and that we are kind of identifying through the Gemen system on these reports we are generating right now, as well as these reports are also based on the number of islands who are still submitting paper-based registration forms, so that we get it flagged through Department of National Registration, and Ministry of Health is right now addressing this issue. The local government authority is taking the key lead in implementing and rolling out the Gemen across the country, and the LGA is right now providing retraining to island councils and hospitals where there has been staff turnover, and where they are right now not using the Gemen module. So these are being addressed, and the teams are active and providing these trainings even through Zoom and online platforms. And local government authorities also right now developing an e-learning module on how the different councils and health facilities can use the Gemen and how they can do data entry into the Gemen system. So the module is right now being developed together with the assistance from UNDP. We are also looking into the possibility of integrating Gemen into the district health information system, which is right now being piloted across the country, and how it how we can use the HIS tracker to monitor the vaccination of the newborn babies. Again, this is where issuing a unique identification for each baby born becomes crucial, and this requires certain level of policy decisions that needs to be taken, and we are moving forward with it as well. We are yet to make progress on the reporting module. We unfortunately do not have a programmer right now who can work on it and have a very fancy dashboard and reporting modules generated to cater to the needs of Ministry of Health, for the National Maldives Bureau of Statistics and other key stakeholder agencies involved. So that's where we are right now. So just to summarize, our Gemen module is still in its infant stage, but I guess with the review using this BPI framework, we have been able to work together and make tremendous improvement with the key stakeholders who are involved in it. And right now, multiple agencies are actually making use of the Gemen. So we have a long way to go, and we hope we'll get there soon. So that's it from my side. Thank you.
Thank you very much, Riaza, for presenting the experience of the Maldives. And it's really great to see how the findings and improvement policies that were determined through this project, how they're going on to inform the ongoing system strengthening efforts. And I remember during the ministerial conference on CRVS in November, one of your colleagues actually presented on the excellent Gemen system in the Maldives during a side event. So it's fantastic to see how this BPI project is also feeding into that work. Also great to hear about the reactivation of the CRVS technical team in the Maldives. So thank you very much. So I think our colleague from Bhutan has been able to join. Sorry, you had some technical issues. Mr. Sonam Wongdi, are you there?
Yes, I'm here.
Thank you very much for joining. And over to you to share experiences and findings from Bhutan. Thank you. Would you like me to share your slides, or are you okay to? Okay, we can see them.
Can you see my slide?
Yes, we can. Thank you.
So, firstly, so sorry that I made a mistake with my timing. I was actually in another meeting, and I thought I had another hour to go. So sorry for the inconveniences caused. So let me briefly share the experience of implementing the business approach for improving and strengthening CRVS system in Bhutan. Although I must admit that because of the pandemic and the lots of lockdown, although we came up with this strategic plan, we could not achieve much, but I can share some of our experience for the benefit of other countries. So just to set a context, if you wish to know about the CRVS system in Bhutan, so our CRVS system used to be paper-based until 2002, and then database was developed in 2003, and in 2011 it went online, and now the CRVS civil registration services are available across all the countries. We have 20 districts and 205 blocks. So in all of these places, we have the you should say kind of universal access to the civil registration services. So this is the main topic of my presentation. So in web, I think although we started in 2020 towards the end of 2020, but mostly in 2021, with the support from WHO and also from ESCAP, we were able to assess our CRVS system. And the main objective of the assessment were to analyze the process of vital registrations and also to examine the key performance indicator and identify gaps and the root causes and then recommendation, and accordingly redesign our CRVS process. And the method that we adopted was obviously one is business process mapping using the Bizagi tool. There's a tool called Bizagi, which the WHO has provided us the capacity building on it, and then we use this tool to mainly to use the maps. And we also use this CRVS analysis and redesign SAR tool, and we adopted multi-sectoral consultations, and also in between we also sought the expert views from the WHO and UNESCAP and all. And based on this assessment, then we were able to come up with the AAR, which is assess, analyze, and redesign report. And also we were able to generate, using those the so-called Bizagi tool, we were able to generate the as it is, the current practice in the form of map. And also based on the gaps and issues that we discovered from those reviews, then we came up with the as desired maps of our registration system. And ultimately it resulted in developing our the first, I should say, the first ever national strategic, multi-sectoral national strategic plan for CRVS in the country. Just to give an example of how we adopted the business approach mapping, maybe I'm not sure whether you are visible or not, but I cannot help. I have to present whole of this map just to explain. So, for example, out here there are three domains. The first one is the health facility domain. Second one is family or the parents domain, and third one is registration services. So, for example, this is the example of as it is, how it is, the current situation of prior to our assessment. And then this is regarding for the birth occurring in the health facility. So, for instance, like you see at the facility label, the birth occurs, and then health workers issues the birth notification. I hope you guys can see my cursor to guide you. So, and then with the birth notification, the family or the parents, and I mean the parents, they go to the registration center. So if they wish to register at the moment, at that particular point of time, they can follow the due process. If not, then because we have the annual census taking place, and they can do during that time. So if they wish to register their child, then they collect all the complete documents and then submit to the registration point, and then they go at the registration label, the civil registration system. The registration official verifies the documents, signs the birth registration form, and then following that, registration official issues acknowledgement to the parents or the family, and the birth is registered in the system. So it will get updated in the household register, updated in the form. And then at the same time, for the parents and the family members, they receive the SMS, the mobile SMS confirming that their birth has been successfully registered. And then next come the issuance of birth certificate. So in Bhutan, the birth certificate is not necessarily mandatory. So if they wish, they can claim. If not, they can. So the process ends here. So if they wish to claim the birth certificate, then the process is such that they have to go back to the registration center. Then they get something called the national identity certificate, and then again go back to the health facility, and then the health facility issues the birth certificate. So this is a very long and cumbersome process, which we came to find out while reviewing using the business approach mapping process. And then based on this, we have found a lot of cumbersome and duplications and things. And then we prepared our design, our expected map. So out here, this is one of the alternatives we are planning to adopt. So now it has changed, the process is changed. For example, the pregnancy occurs at the parents or family member domain, and then they come to the hospital to avail the antenatal care and all. And at the same time, at the hospital, the healthcare professionals collect the required documents. And then birth occurs at the health facility. And then if the documents are complete, then they can straight away go to the registration process and follow the due process. If not, they can go back and compile, bring all the required documents, set of documents, and then they can process. Then they get registered, and we also, so birth certificate can be issued at the hospital, or they can avail also from the registration or from the health facility. So this is how we, based on our using the business approach mapping analysis, we come to redesign and to shorten and to bring about efficiency and effectiveness in delivering the civil registration services. So this is one of the example for the birth only, but we did for the death and cause of death and process and all. So this is one of the, in the interest of time, I'm just demonstrating one of the examples of how we did go about with the business approach. And just to quickly run through, then one of the approach we adopted was finding the root causes of each of the. So, for example, first that we identify broadly at the different levels, like policy labels. If there are issues, then we go deep down and find out what led to these policy issues. So, poor governance and incomplete debt, low debt registration are one of the key issues. And what led to these factors was also we went on further down to find the root cause for each of the components. So this is at the policy level, and next is at the business process level, and next one is at the infrastructural or ICT or HR things. So for the each components based on the business map, then we try to dig in further into the root causes. This is just to show as an example. And then based on those gaps identified, then we come up with the recommendations. For example, engagement framework. So in order to ensure that engagement framework, what needs to be done? The formulation of national engagement framework or governance needs to be established. And similarly for the business process, and also for the capacity building, and it applies to all. So based on those issues that we identified at the root cause, at the root level, and then we come up with the appropriate strategic recommendations. So ultimately resulting in the development of the multi-sectoral strategic action plan. So this is the outcome of our whole of our exercises. We come up with the multi-sectoral national strategic action plan, and these are the core components of the strategic area, like the governance, policy, and political commitment, capacity building, and then ICT implementation. Then of late we are integrating this ICT 11 version into our system, and then community advocacy and publication of annual vital statistics using civil registration data, which we have not done before. Just to highlight some of the achievements or ongoing activity that's happening at the moment. So this year we were able to generate our second vital statistic report using the civil registration data. So we did, for the first time we did in the 2020, and this is our second publication. And then currently we are also piloting because in our gap analysis, we found that our MCCD, the medical certificate of cause of death, were not in line with the latest international norm and also not practice it uniformly. So we are doing piloting at one of the referral hospital, and also we are trying to integrate this. WHO has come up with the online form using the DHIS2 platform. So we are also trying to integrate that one, and then later in a few months' time we want to replicate in the nationwide, so that at least the death component will be improved of this year. Death component of the vital statistic can be improved. And thirdly, we also have Bhutan is also developing this electronic patient information system. So whereby all the patient will be tracked from the birth or from the, let's say from the cradle to the tomb, something like that. So we will be having a whole history of the individual patient being captured. And we, in order to improve our the vital statistic component, we have integrated the whole of the ICT version coding system into this EPS system. And Bhutan is also implementing the national digital identity. So this will cover, unlike in our assessment where we found some of the people residing in countries, for example, immigrants and those things are not adequately captured, but with the implementation of this national digital identity system, whole of the people, no matter your nationality or whether you're outsider or insider, but as long as you live in the country, all of them will be the national digital identity, the biometrics will be captured, and then this is going to immensely improve the CRVS system in the country. So these are just some of the examples of major initiatives that we are doing. I think that's all from me. Thank you.
Thank you very much, Sonam. We're really happy that you could join us, and it's great to hear about the experiences of Bhutan in implementing this project, and also to hear a little bit more about how the findings are being potentially used for ongoing strengthening efforts. It's also interesting to see some of the commonalities and the bottlenecks which have similarly been found in other countries that we've been working with. I think especially the need to obtain lots of documentation and witness statements in order to register a vital event. It's also great to hear about the development of the electronic patient information system. Okay, so this brings us now to the Q&A part of the Stats Café. Thank you very much to all of our excellent speakers for your presentations. And to our audience, please do type any questions in the chat box and mention the name of the speaker if you wish for it to be directed at anybody in particular. We have one question in the chat so far, and that's it would be great to hear from Bhutan and Maldives what kind of advice they would give to other countries interested in doing mapping of their own processes. So if I could ask Mr. Sonam, if you would kindly respond to that question first, and then we can move on to Riyaza. Thank you.
Thank you for the question. Just a general comment, suggestion. I think this business approach, the mapping systems, was conventional. We used to do a lot of consultations and then gather the feedbacks and try to come up with the recommendations. All, but this using this map, for example, the Visagi tool, there must be other tools as well. But what WHO they have shared with us was a Visagi tool, where we were not familiar of it, and then they got us trained on this tool. And then I think if you use this map system, it's very, because it represents our issues and challenges or dislinkages in the pictorial form, so which we can like clearly point out where needs to be intervention needs to be taken place, what needs to be modified, or so it gives a very, I mean, what you say, the pictorial form, and it's very quick to understand. So a lot of things which we do not capture in the normal, the consultative discussions and all, if you present in this pictorial form and then like graphic form, it gives a clear idea of, I mean, the good clarity on how to go about. So I would suggest the countries, if you have not yet started reviewing and assessing your thing, I think I would suggest one of the ways is to use this tool. Maybe there must be other tool as well, but how to make better use of this the pictorial form too, so it can vividly show you where are your gaps and where are your weakness and all. So one of the suggestions could be, this could be one of my suggestions from me. Thank you.
Thank you very much, Sonam. And yeah, I completely agree. I think something that we found is that when we've been mapping the processes, in the tables, it's not so user friendly, and the maps really help to kind of have an overall picture of the whole system and the different processes that were involved in birth and death registration. So definitely the mapping is very, very helpful. Riaza, I wonder if I could kindly call on you to also respond to this question and what advice you would give to other countries interested in doing mapping of their civil registration system.
Thank you. What I would like to say is definitely having all the relevant stakeholders on board and having their commitment would be very crucial for us to complete a project on a short duration. That's one of the things we noticed. And having access to the documentation of how the process was done in the previous system and looking at the records that we can generate from the current system. I mean, those were crucial things that we had to address while we were carrying out the business process with different stakeholder agencies. So, and having equal participation from technical level as well as from the policy level in this discussion is very crucial for us. So, I mean, if you are to take on such a assessment, that would be the key support you would need to have the project completed in time.
Yeah, definitely. I think those are really important factors to consider. Thank you. I'd also like to ask Subhashri and possibly also Raj Mitra, who's also in the call. Raj has also been working with Subhashri on the BPI project in some countries in the region. The question I'd like to ask, this is one that we received before the session began, and that's how has the experience been working in different contexts, and how have you found that the BPI approach has had to be adapted depending on the country context? So for Subhashri or Raj?
Yeah. So actually, the experience so far, I was supporting RAS for vital strategies countries and WHO countries, and the experience actually quite different from one country to another. For example, as Sonam explained in Bhutan, they have a great coordination with all the stakeholders, and they were very highly efficient what they were doing. But in some countries, it was difficult for us to communicate with the stakeholders and get them into one table to discuss and draw the map. And COVID happened, so there are many issues in between during COVID, when the COVID happened, and the country were not able to come to one point and sit and discuss the problems and gaps. But for example, in Nepal, they hired a consultant after a point, and the consultant actually helped to fasten the process. Before, we were depending upon the country teams to coordinate the process, but later we thought that it would be great to hire an external consultant who will help the country to lead the project. For example, in Cambodia, they are following the whole process, like step by step, like what is written in the CRVS framework. So it is very, very helpful. They are actually following like everything what is written in the CRVS framework. In Vietnam, the context was a little different. They wanted to start the actually they are doing the legal review once they're doing the BPM process and the KPI analysis and the legal review together. So it is very easy for us to recommend what in the legal review what we want to recommend. But in some countries, the legal review has already been completed, so it's difficult to give them suggestions because they can't change the legal review. So these are some of the experiences we had with the countries. I think Raj can add more. Yeah.
Thank you. Raj, I don't know if you want to add anything.
Subhashri has more or less covered. Yeah, I think mapping is an important process, as Bhutan has said, and Bhutan was very well trained, and Bhutan actually they had a small working team with all the stakeholders, the health, which Sonam was there. We also had a colleague, and then we had the statistics office as well as the health, the civil registration office. So there was a team of young people who were sitting around the table and mapping and sending it to us. We were reviewing together and all that. So and one thing we have to notice is that you can have an overall map, but you should also have sub-process maps, because we had a complete sub-process map for Bhutan's notification, because in order to get documents done and come to registration centers, like collecting signatures of the health, then go to the household to get the signature, then going to somewhere. So you have to take 4 or 5 signatures before you arrive at the civil registration center to produce a document, to apply for a registration. So that was shown as a separate map altogether. So you can have an overall map, but you really need sub-process maps also. So Bhutan did all of that, including what is happening within the registration center. And those, you cannot put it in one big map and try to find the problems. So there is an overall map where you see interaction between different stakeholders. And there is another map which is within the organization, which creates, you can see duplications within the registration centers as well. But then it all helped, as Sonam has rightly said. Otherwise, you can go around and ask questions as to what the problems are. You will never be able to see the full picture or even the detailed picture within a particular sub-process. So I think it went very well. And I don't know whether Sonam told you that they did a strategic plan which is costed. So they costed every single activity, and they also costed every single strategic objective. They costed every single goal, and also identified who is the lead and their timeline. So I think it's a very complete solution. Thanks.
Thanks, Raj. And yeah, that's really great to hear that Bhutan have developed a costed strategic plan. Actually, Sonam, I wonder if I could turn to you for the next question, because there's one in the chat. Somebody is asking what types of proof of documents are required while digitizing personal information in Bhutan?
Thank you, Chloe. In terms of this one, right now they are at out of the 20 districts, I think they have completed about 10 of the districts. So right now they are in the initial phase, they are focusing on the citizens only. So right now I also went to this registry, I mean National Digital Identity. All I need to produce was my card, CID, a citizenship ID card. And that was enough. So maybe for I think foreigners working in the country, maybe they will be able to maybe like their own passport or something like that might do. But the aim is to have everyone taken their digital identity. So what for the other, I'm not sure right now, but for Bhutanese, we just need to show our citizenship ID card. Thank you.
Thank you very much, Sonam. I think that's all we have time for today, as we've got 1 minute left in this session. Sorry if we didn't get around to your question, but maybe our speakers kindly answer your questions in the chat. Thank you for all of your interesting questions, and especially to our speakers for your excellent presentations, and also your engagement during our Q&A session. Although today you heard about the completed projects in 2 countries, the work is still ongoing in other countries in the region, and there are also other countries in the pipeline to be onboarded with this work soon. So if you have any queries about the Business Process Improvement Project for CRVS, please do get in touch. We would be very happy to hear from you. And finally, if you're interested in related CRVS activities in the region and beyond, we encourage you to subscribe to our CRVS newsletter, and my colleague Nasikan has posted the link into the chat box. So you can click on that to subscribe. So thank you very much, and thank you again to our great speakers for today. Have a good rest of the day. Bye-bye.